Venous leak. That's a huge problem that we're seeing. And I think we're learning more and more that a lot of erectile dysfunction is actually venous
Yeah,
leak more
totally.
so than arterial dysfunction.
Totally.
I mean, you've mentioned some causes of venous leak, obviously, but I think people are just perplexed. Like, how do we, because it's very difficult to treat it with traditional means, right? They don't respond as well to medications or injections as people who have really, truly arteriogenic dysfunction. So, what do we do about it?
So venous leakage is the equivalent of you're a firefighter, you're in the city of Los Angeles, it's the summer, and all you do is breathing smoke. You have pulmonary fibrosis. It's excess collagen in your lungs.
Hmm.
Okay. Or you're a drinker and you have liver cirrhosis and you have excess collagen in your liver. Or you have a heart attack. You stop blood flow to the muscle turns into scar tissue. And when your heart pumps, instead of the ventricle squeezing, getting all the blood out, the ventricle squeezes only a little bit. That's heart failure.
Hmm.
So you have lung failure, you have liver failure, you have heart failure. Let's say you drink a lot of mercury and now your kidney turns into mush and it's full of scar tissue. Basically, venous leakage or accumulation of connective tissue within the erectile tissue is the failure of like every other organ.
Hmm.
We're just like a part of all organs.
Hmm.
They fail by getting connective tissue. The physiologic impact is that the tissue can't expand. It is a requirement to expand. The penis, unlike the liver, spleen, kidney, changes volume in physiology. Does your liver change in a 24-hour
I
day?
hope not.
Yeah. Do your fingers, do your arms, do your muscles? I mean, nothing changes. It changes for a reason. It's not because it's fun that it gets wider and longer. It gets wider and longer because that's how it blocks the tissue. Its expansion against the capsule
Hmm.
stops the space that where the veins live, which is just the space between the tissue and the capsule. So it's called the subtunical space. The subtunical venules only, it's a sponge. Blood is getting into the sponge. The only way it can drain is the peripheral spaces because each space just communicates to another space. The
Hmm.
only way out is the peripheral spaces. But if the peripheral spaces are squished by the expansion, then you trap. I mean, essentially, the penis is the only organ that has a closed compartment during its physiology. Every organ is blood in, blood out.
Hmm.
If you have blood in, blood out with the penis, you're kind of screwed.
Yeah.
So they're essentially all of ED is that,
Hmm.
and it's a degree of how much scar. And now with ultrasound, I can tell you how much scar you have in your penis. And basically, you have two choices. You have a choice called symptomatic treatment. You magnify whatever muscle you have, its ability to maximize relaxation. So 4 treatments for that. You have your pills. You can stick needles in your penis and inject vasodilators. You have subcutaneous bremelanotide. I think we've talked about that
Hmm.
with the orgasm. And we have intracavernosal Botox.
Hmm.
All those things maximize muscle relaxation. Then we have another strategy called disease modification, where we can grow muscle. If we can grow muscle, we can change the ratio between the muscle and the connective tissue. You want as much muscle as you can to lessen the effect of the too much connective tissue. So for that, we have Shockwave and PRP. More or less, you have 6 treatments for ED before you get to the implant,
Yeah.
and you play with those strategies.
Are there supplements that you recommend for erections?
I mean, truthfully, if you want to do evidence-based medicine, you got to do placebo-controlled double-blind things, and there's no data on supplements.
Right.
It's kind of like snake oil a bit.
Hmm.
I'm sure there's some supplements that are good. Supplements can be bad. There are supplements that are basically 5-alpha reductase inhibitors, and there's supplements who are used for depression. And we've already talked about
Right.
some of those not being so perfect.
Yeah. And the supplements have a wider range of activities that you can't necessarily quantify as well as you can with pharmacologic agents, and they're adulterated sometimes.
You know, what's fascinating about supplements, I love this. I'm glad you brought this up. So there are people who took finasteride,
Hmm.
and they're screwed.
Hmm.
There are people who took SSRIs. They're equally screwed. And their conclusion is drugs are bad.
Hmm.
But they'll do 1 million supplements as
Yes.
if magically supplements are not harmful, which is
Right.
completely false.
Completely false. And we've
Supplements,
seen liver injury. We've seen
yeah.
just so many horrible things. And, I actually read a paper that people who have too much copper it actually causes erectile dysfunction. And some of these supplements have a lot of copper in them, you know?
Well, I mean,
So
even I'm learning. I didn't know
yeah,
this.
yeah, I read this paper and I was like, oh, that's so interesting, you know? So people think, oh, it's just a mineral, right? It's not a big
Yeah.
deal. But yeah. You mentioned Shockwave and PRP.
Yeah.
So let's talk a little bit
We
about
do a lot of
those.
that.
Yeah. So
We
tell
have
us
2
about
machines.
yeah.
I'm
So
part of the International Society for the Study of Medical Shockwave Therapy. I love
I
this.
didn't even know there was a society.
Oh God, it's huge. And so it was in Amsterdam last year. Of course,
Mhm.
getting to Amsterdam, it's just fun.
Yeah.
So there's a reason to join the ISMST. But so I meet a cardiologist, actually a cardiac surgeon.
Mhm.
Okay. And basically, it's a life-changing meeting. You know, sometimes you go to a lecture and you sit there and it's boring. And sometimes
Mhm.
you go to a lecture and say, holy God, I'm listening to something that's unbelievable.
Yeah.
So here's
That
this
changes the way
cardiac
you think about
surgeon
things. Mhm.
who shows movie of him opening the chest,
Mhm.
having the beating heart. This is on all his video. And he takes a shockwave device and he shocks the beating heart.
Okay.
So his paper, which is published, takes people with heart failure. Their muscles are kind of dead. They have too much scar tissue. We've had this
Mhm. Yeah.
conversation. And guess what shockwave therapy does?
It
It
made
fixes their thing. They generate more muscle. Their contractions increase. They get out of heart failure. They're able to run and do all the things that otherwise they could never do. And what was the treatment? Shockwave therapy. So
wow.
it's the first human example of the capability of the regenerative nature of muscle growth in vascular tissue. I think it was, I walked out of that lecture. I went straight be right to the guy, shook his hand, took a photo with him, and I said, I want to know everything you're doing because we're going to do the same thing in the penis. So that's what we ended up doing. Double-blind, placebo-controlled trial with Shockwave. It was fun to do the placebo, by the way.
Yeah.
You know, like Shockwave you could feel. So
Mhm.
we had to figure out a way to
To
do
make them feel
Shockwave
it.
where we're not doing Shockwave.
Yeah. So how'd you figure it out?
So we put people in a curtain so they couldn't see what they were doing. We had noise reducing
Headphones, yeah.
headphones so they couldn't hear. We put the probe on their penis, activated a recorder of the sound of
Okay.
the shockwave, and we're putting it on and moving it up and down as if something's happening, and the sound makes it sound like something's happening.
Yeah.
But nothing happened, which
Okay.
was very cool when we analyzed the data because we do before and after ultrasound
Mhm.
to see if the ultrasound reduced the black
Mhm.
and increased the gray. We have already
Yeah.
talked about gray is good. So we couldn't change the ultrasound by doing no treatment to the patient.
Of course.
Well, of course, yes, but who knew, right?
Yeah.
You had to test that.
Yeah.
And the only way we could increase the gray was to do shockwave.
I mean, we've had over a decade of data on Shockwave. What frustrates me is that it's still not shown to be, it's still not in the guidelines for
Yeah.
erectile
What's gonna
dysfunction.
they made new guidelines, which are even worse now. They're saying
Mhm.
don't do it.
Yeah.
So I think the attitude of regenerative therapy is sort of incorrect. They're trying to make it a therapy like Viagra. You
Yeah.
know, that this independently can improve erections and sort of cure you. I think shockwave therapy and PRP therapy are therapies that help your current state of too much collagen to lessen the collagen and make injections which didn't work now work, to make Viagra which
Right.
didn't work now work. If you
Right.
view it that way,
Same thing with the Botox.
it's
Yeah.
the concept of avoiding a penile implant. Now there are people who say, I just want my implant, just do it. This is torture, all these crazy things. It's also expensive because none of these are really covered. But there are people who say, I'm not doing the implant. I had my radical prostatectomy. I'm done with surgery down there. You make me have erections and figure out how to do it. I think these are valid ways to help people.
Yeah. I definitely am convinced by the Shockwave. PRP, has been some controversy. There's been some randomized controlled trials that were negative. So what do you think about that? Do you think it works
Well, we
alone
do
or?
before and after ultrasound with
Yeah.
PRP. We do before and after ultrasound with Shockwave. In our population, I could show you benefit.
Okay.
I think it's the same thing. More or less, they activate mesenchymal stem cells,
Mm-hmm.
which then make downstream muscle cells,
Mhm.
and that's essentially what you want.
Yeah.
But do you make it in a degree to which you now can walk around and be a 12-year-old boy? No, not going to happen.
Do you think if there's guys listening who are like, I want to have the best erection possible, is there value in someone who's normal using these therapies?
That's a fabulous question. If you're normal, you shouldn't be doing anything that has risk, and obviously anything that you do has some risk. If you ask the question, if you are on Viagra and you already have a problem, should you now consider to do prophylactic improvement of your smooth muscle health? I think you have an argument there.
Yeah.
Because you're already on a therapy and you're already down that slippery slope of
Right.
evil. Because I'm on ISMST, this medical shockwave therapy, my brain is saying to me that the current strategy where the equipment is bizarrely expensive, you have to go to a doctor's office, you got to get multiple treatments, and then you go home. That's not the correct way to do shockwave. I believe shockwave therapy is something that you do like insulin. You just keep doing it.
Yeah.
You keep activating stem cells more than stem cells are being activated inevitably, because all stem cells are being activated. I think it's a thing you do at home, like you exercise, like you eat well, like you shockwave regularly. It needs to be a home device.
Well, there are home devices, but they're not the
No,
same.
they're not shockwave.
Yeah.
That's bullshit.
But
Excuse me, I didn't mean that word.
I just want to be clear because people might hear this and say, "Oh, I should just go buy that shockwave therapy."
It's called Phoenix, and it's a complete waste of time.
Yeah.
It's radio ballistic pressure waves. They do nothing.
Right.
They have
It's like
no
an expensive
energy.
massage.
Double-blind, placebo-controlled radio ballistic pressure waves don't do anything.
Right.
Yeah, it's like
So
a
just-
massage.
Yeah.
You massage your penis many ways, like jelking. But true, genuine shockwave, for reasons unclear, is they make bells and whistles, they make it expensive. It really needs to be a home thing.
Yeah.
It needs to be declared by the FDA, not a device class 2, which means you have to have a physician involved, but class 1, which is what radio ballistic pressure waves are.
Yeah.
Need to make them the same.
So as of right now, if anyone is giving you a device at home, it is not a shockwave.
It's not a shockwave
formal
device.
shockwave.
It's
device.
a kind of a waste of your
Yeah.
time.
I think the other challenge is there's a lot of so there's cheaper shockwave machines that are radial versus focus, and people.
Well, they're not shockwave. Don't make that mistake.
But that's what they're calling them.
Yeah, but
right?
it's not shockwave. They're lying.
Right. So, but for the average consumer, it's very difficult.
They're called
to know.
acoustic waves.
And they look the same. They sound the same.
By the way, a radio is an acoustic wave. It's cheaper to take a radio next to your penis, by the way. It's the same.
Sure.
You're saving a lot of money.
Right. So just make sure you ask that you are getting focused shockwave, because
Right.
I think what happens is these people get taken for a loop. They
Right.
get,
If
I'm getting shockwave. It's cheaper than
If it's in your
whatever.
shopping mall, it's probably not.
If there's no
real.
doctor involved,
Yes.
be
In
thoughtful.
our office at
Mhm.
San Diego Sexual Medicine, only providers provide shockwave. We don't
Yeah.
have techs doing it.
Yeah. I do it myself
that's-
too.
Yeah, I think it's a lot of fun, actually, but it's another conversation.
Well, it's like a good chat with your patient and
Right.
hang out. So you already told us about how you switched over to female sexual dysfunction.
Well, we
because-
broadened the version of sexual medicine for men to sexual medicine for both genders. I think that's the way to think of it.
What do you think is the most misunderstood thing about female sexual function?
That there's no help you can get, because
That's
there is
true.
plenty of help you can get. You just have to find it. I think the nightmare is the provider availability is pretty limited.
Mhm.
ISWISH. If you're a woman, find an ISWISH provider. You have
Yeah.
the best chance.
Absolutely.
But there's so much we can do for HSDD, for arousal, for orgasm now, for specifically the pain disorders.
Do you think we over psychologize sexual dysfunction?
I hate to get involved in that because psychology is just so important, and it's
Well, I think
so
it's-
intimately involved with everything.
Yeah.
It's all sexual dysfunctions are 100% psychological,
Absolutely.
but a lot of them are biologic, and the biologic is the trigger that sort of manifests the psychology.
Right. Once you have a problem, you can't stop thinking about it.
and it just festers.
What I mean is, I think that a lot of people go see their doctor and they're told it's all in your head.
Yeah, well, that's the
That's-
nightmare. Because
That's the problem.
it would be wiser for doctors to say, geez, I'm not trained in this.
I don't know.
I
Yeah.
don't know.
Yeah.
And then rather than give people the it's in your head thing.
Yeah. I'm sure you say, I don't know. And I say, I don't know all the time to patients,
I
because there's
do.
things that we don't know.
But then I go on AI.
But it's not perfect.
It's not perfect.
It's not perfect. Open evidence is a great tool that we have. I don't know if you've used it.
I don't.
It incorporates all the research from like journal JAMA and New England Journal. Like it gives you very very detailed.
I don't think they're really good open evidence in sexual medicine.
They're not great, but meaning you can ask the same question on different computers and get different answers.
Yeah.
So it's not always
Welcome.
perfect. Yeah. um, you've talked a lot about oral contraceptives
Right.
and how they impact female sexual function. Now, I think they're great in giving women the ability to decide when they want to get pregnant, but there are some women who have real sexual dysfunction after using them. Can you talk about that a little bit?
Hormonally based contraceptions goes back to the 1960s, where you were able to stop ovulation. So if you can stop ovulation with medication, you can't get pregnant.
Right.
Okay. But magically, for reasons unclear, 100% of hormonal based contraceptives raise a protein from the liver called sex hormone binding globulin.
Mm-hmm.
And I don't mean raising it from 25 to 28. The normal value is in nanomoles per liter, 25. It goes to 400 or 500, okay? So sex hormone binding globulin is a globulin, a protein with lots of amino acids that binds, sex hormone binding, to sex hormones. It binds sex hormones. Of the things it binds is testosterone, rendering it not available.
Mm-hmm.
So whatever you have in your body, it's all sort of stuck on this protein and not really available.
Mm-hmm.
Okay, that's 100% of users. There's 50 million users. So 100% of 50 million people have low testosterone. Okay, but not everybody has sexual dysfunction. God bless those who don't have sexual dysfunction. Their androgen receptors are very happy dealing with low testosterone. They'll still make the protein needed
Yeah.
based on their testosterone. But there are a bunch of people who have really lousy androgen receptors. I studied this. We measured the androgen receptors
Mm-hmm.
in people on this product called Yaz
Mm-hmm.
who did and did not have symptoms. And what discriminated from them having and not having was the quality of their androgen receptor. So people with crappy androgen receptors require higher testosterone to make the protein,
Mm-hmm.
but they're not getting it at 50 million people. So yeah, it's kind of a nightmare. So there's a thing called LARC. I don't know if you promote LARCs or discuss LARC, long-acting reversible contraception. There are no side effects sexually.
Mm-hmm.
So if you had to pick and choose between a hormonal birth control, which can 100% lower your testosterone, not can, but does.
And that manifests in low sexual desire.
What low sexuals are depression. How many young kids are in college with depression? Guess what they go on while they're on hormonal contraception?
SSRIs.
They go on SSRIs. That's double nightmare,
Yeah.
double jeopardy for these people. Yeah, so it's a drug causing another drug problem. Yeah, welcome to America and to women and their sexual problems.
Well, let's talk about low sexual desire.
Okay.
What is your? I think we've heard it too much. Go drink a glass of wine
Yeah.
and relax, which is all bullshit. What do you do for women with low sexual desire?
Well, we listen to their story, ask
Yes.
them lots of questions. They're not wanting to want. So whatever their reason is, at the end of the day, it's like orgasm. It's a central thing. There's an imbalance in excitation and inhibition.
Mm-hmm.
And remember, we talked about orgasm where they both work together?
Yeah.
These ones work opposite.
Yeah.
So if you want to be interested, you got to access your excitation chemicals and you got to turn off inhibition.
Mm-hmm.
So there's two, amazingly enough, FDA-approved products
Mm-hmm.
that activate excitation or turn off inhibition. So one of them, the first one was flubanserin, which, by the way, at this year's This Wish, you're going to watch a movie called The Pink Pill. I don't know if you've
Yep.
actually also,
Mhm.
probably already seen it.
Yeah. No,
Okay.
I'm
You'll see it
well
again.
aware. I'll see it
It's
again.
really cool.
Yeah.
So flubanserin is an agent that's FDA approved for that. It's a daily pill. So a lot of people like the concept of not dealing with it at the time of sex, just
Mhm.
take it all the time. And then there's the subcutaneous bremelanotide, FDA approved for HSDD. But a lot of people like the idea of taking it only when they have sex. It's kind of like a Viagra concept.
Yep.
For men, it's not a stretch to say I want a better performance. Let me take my Viagra.
Mhm.
So women will say, let me take my Vyleesi. In a discreet way, they'll do the EpiPen injection and have many hours of lots of dopamine.
Yeah.
So they'll have excitation more than their current inhibition. So yeah, it's a you have to discuss if it's situational or if it's lifelong or if it's you have to get into the meat of all of this.
Yeah.
But we do have two products. And then, of course, testosterone is um, it's an agent that clearly is involved in desire. And there's a lot of people on birth control pills who have done away with their testosterone by raising this binding protein. So there's lots of stuff to do.
And that raise in that binding protein doesn't go away, right? After?
So, yes, now we're getting into another drug and its nightmares is it doesn't ever return it to
To
its
baseline.
value prior.
Yeah.
Yeah, the body learns to stay with high SHBG. So as that person ages, the price for taking birth control pills at a young age is a permanent elevation of SHBG, or a permanent, if you like, low testosterone state. So
Mm.
that leads to depressions and low interest and bone disease and muscle disease and tiredness and blah, blah, blah. It's
Yeah.
horrible.
That is horrible.
And add to the sad state that there's no FDA-approved treatment for testosterone. No one's even measuring testosterone because they have nothing to treat with,
Right.
unless you don't mind going off-label and using Bale testosterone products.
Yeah. Which work.
Yeah, which work and are widely used in our office.
If you guys like that clip with Dr. Irwin Goldstein, make sure to check out the full episode right here.